Hi, my name is Kellyn Ender. I am the Interim Executive Director at Building Hope, Summit County. We are located in Frisco, Colorado, and my role with the Impact Behavioral Health Program has been to manage our scholarship program, which offers 12 free sessions of care, mental health support, and therapeutic care to folks who live or work in Summit County, and those who are suffering from perinatal, postpartum, or infertility issues related to their maternal mental health. We work as an organization within Summit County to offer stigma reduction, connection to care, access to care, and reducing barriers for all things mental health. Our mental health scholarship program was developed to really help support those who are in some sort of financial barrier to care who live and work in Summit County. We were working with organizations and partner organizations around maternal mental health. We were contacted by our local OBGYN clinics and doctors who were concerned about the health and the mental health of some of their patients. And Building Hope was called upon to help support those folks to get therapy, to be connected to therapy, and to help support the payment of that therapy. And so we used our already existing scholarship program to really help connect mothers, new moms, new parents, those suffering with postpartum, depression and anxiety, to meet the needs of the community. We have several Spanish-speaking therapists who are available. We also have support groups that are supported through the Impact Behavioral Health Grant, and those support groups include a new moms support group, as well as a Moms of Tots and Parents of Tots support group, both of which are facilitated by a local therapist. And then there's a partnership with our WIC, our local WIC program, to help with lactation consulting and anything else that might come up from that side of things within the group. We're really excited to help support this area of our community and have seen the impact that it has had through our scholarship program. We have seen a great impact from our Impact Behavioral Health grant, and we have issued over 50 scholarships to our clients that pertain to this group of folks in our community suffering with postpartum, perinatal mental health issues, or infertility. We've also seen a number of different support groups. We have 2 different groups that are running, and each group, usually there is 5 to 7 different participants in each group that runs weekly, and that's with our new moms group and our toddler group, parents of toddlers group. And so we have lots of different folks who are able to get access to care, who are access to see a therapist when they're in need, and be able to do so without having to worry about some sort of financial barrier. We've also seen the partnership grow between our OBGYN clinics and Building Hope and other community partners such as the Family and Intercultural Resource Center. We've really been able to support these new moms in this new phase of their life. All of what we do here at Building Hope has to do with our partners. There's a kind of saying within Building Hope that says we are our partners. None of the work that we do would be possible without the partner organizations and the work that we do with our partners in the community. Building Hope is not an organization that would be able to stand alone. We don't provide any direct service, so we really lean on our private practice community, our clinics, our mental health serving agencies, the Family and Intercultural Resource Center, our Summit Community Care Clinic, the Summit School District. We have partnerships with our co-responder team, which is out of the Sheriff's Office. All of these different partnerships really help us provide the work that we can within Summit County and serve our community in the way that we need to. We would not, again, be able to do any of the work that we do as a nonprofit here without our partnerships, because we don't actually provide the services. Our partners do the work, and we help fund the opportunities and fund the services through to our community. So we are so grateful and so thankful of all of our partner organizations. We truly, truly could not do this work without them. Regarding advice or recommendations I would have for other communities that are interested in doing this work, is that I would really, again, look to the partners, look to the people that are doing the work already, that have touch points with pregnant, new moms, postpartum, whether that's local hospitals, OBGYN clinics, healthcare clinics, outpatient behavioral health clinics, all of those things, really working with them to work together to serve this community. It's so important to have the collaborations and the connections. And in our work within mental health care and healthcare in general, we tend to be really siloed, and we tend to really have our own needs and our own functions and our own agendas. And that really just, we're missing a lot of pieces when we do that. And usually the community members and those who are in need are the ones that suffer from that kind of use. So I would say definitely partnering with local organizations and working together to build a system of care that wraps around our community and your community, as far as the pregnant and new moms and new parents. Bringing lots of different resources to the table is super important. Having consistent and constant communication, meetings together, collaborative opportunities to meet and greet. We've done several opportunities for our medical providers to mix with our mental health providers so they get to know one another and really can work together to build relationships so that they can better support the patients that they're both serving.